Welcome to another very interesting session of the course Healthcare Entrepreneurship. So far, we have covered the details about what the Indian scenario from a healthcare space looks like, and we have also looked at the various ways to define an idea and how to get the right idea in order to get to that point that we can actually develop a product or develop a service, right? So today we are going to talk about the product development process, the 7 different stages of the product development process, what is the overview, and then we will slowly dig in more in the upcoming lectures into the design aspect, the different prototyping aspect, the marketing aspect, and finally move towards commercialization, right? So hope you all students are doing well and enjoying the lectures. Let's get started. So what are the types of new products typically? So let's talk about that. The first category is new to the world, so which is creating an entirely new market for a product. So there have been so many products out there which are so new and you have probably never seen them around in the market. One very important example is there are some eye based devices like medical devices which are for glaucoma patients, like which are specifically used for draining the fluid out of the eye, or just giving the right amount of fluid so that the eye is hydrated and you can get rid of glaucoma. So there is a glaucoma valve which is a new age device. There are so many implants which were not existing earlier which have come around in the recent times. For example, very aesthetic dental implants. Those dental implants were earlier not there, you are seeing them now in the market. From a diagnostic product standpoint, now you have diagnostic kits for COVID-19, for example, which came around in 2020 or 2021 to be specific. And you have so many different this RAT kind of test, or there is this generic test where you conduct the basic COVID protocols, and there is this rapid antigen test, like that's the other one, which is a quick one. So these products were not around in the market earlier. There are products around diabetes, like diabetes which was not very rampant in India, like let's say 10 years back or 15 years back. Right now you have so many of insoles which are for specifically for the diabetic population. So these are new to the world products, and this basically creates an entirely new market. Okay. The next category is new product lines, which is first time entry to an established market. So there could be established market for a lot of different products, and there is a new product line within that. So one very key example is this thermometers which you're looking at from a digitalized standpoint. So we had analog thermometers, this very catchy, this mercury thermometers. Then we had the digital thermometers where it was a standard, very much similar looking to a normal thermometer. You could place it in your mouth or place it under your armpit. But then we had the scanning thermometers, which was a new product line which came into the market, and lot many companies did not have this particular product. But there was this need in the market due to the COVID pandemic, where there was a lot of incidences of high fever. So that's why the scanning kind of thermometers were a new product line within an existing market where thermometers already existed. It just provided a better way to seamlessly use it and have a contactless kind of an atmosphere. Earlier, you need to be in touch with the patient to basically administer the thermometer and get the readings. Now you can have it completely contactless, and you can have it for your home as well, to take the readings of your family members, like in a very contactless fashion, right? So this is a new product line which had its first time entry around 2020. Like several of the thermometers did exist, but they did not find their importance in the mainstream, right? So this became very popular during the 2020 pandemic, and that's where this new product line was introduced. The third type is additions to existing product lines, which is basically supplementing the established product lines with the package sizes, flavors, and so many other things. So one very common example is the different sorts of medicines which we come across. So if you look at, so Eno is a very common medicine which we all know is for gas. So if you have really high amount of gas in your body and you're getting acidity, you would usually come with an ENO. So the standard ENO used to be in a normal kind of generic flavor, right? Now if you look at ENO, you see so many different flavors, right? You can bring it in orange flavor, lemon flavor, and so many other aspects. Similar with a lot of pediatric medicines. So for infants, there are medicines which are specifically developed. There is a formulation, and there are so many different kinds of flavors which are added to those formulations in order to make it nice or competitive compared to the other brands. And usually if somebody if infant basically takes a minty flavor medicine, he or she may actually like it more than a generic medicine which may be a little sour, right? So some other examples of this is where you had a different packaging size for various materials which are used for the pharmaceutical requirement. One example is you're looking at face shields and masks. Earlier we would have a single mask packeted in a single packet, right? Now you have a range of 100 masks and 200 masks, this kind of packets which are like for the family, right? Like if the entire family is planning to use it. So that's another pharmacy based product, like which is over the counter, which you basically get as a huge packaging of the mask. So that's kind of rebranding it. Sometimes the cost would be much lower. So if you are thinking of using the masks for the entire year, you would probably go for a package of 100 rather than buying a few like 4 or 5, right? So the fourth category is improvement and revisions of existing products, which includes the replacement of existing products. So there are so many products out there in the market which there has been certain updates, and basically based on those updates the products have either been completely replaced in the market or they have been updated over time, right? So some of the examples are if you look at the glasses market. So most of the glasses used to come in one single kind of optics, and then it moved towards a dual optics or multi optics, like where you had bifocal lenses where you could see this round kind of thing within a glass, where somebody has a myopic as well as hypermetropic, like which is short and long sightedness respectively, those kind of visions. Then you have another kind of glasses which is a progressive lens, where if you have some issues with your cylindrical capability, that your cornea is basically sized in a different way, and then you have fairly a good bit of myopic as well as hypermetropic vision, then you can use progressive lens, which is a much more nicer progression than a bifocal. So this has been improvements or revisions to this existing product market, which is if you look at it, it's kind of a medical market only, right? Because you're trying to see better here, right? Similar with hearing aids. So many things have improved over time, where the way hearing aid is used, is it through Bluetooth or Wi-Fi, or is it integrating well with your phone? Earlier it did not used to integrate well with your phone, it would just be direct, or you would see a little bit of information from Bluetooth, but now you have a dedicated app and so many other things, right? So many of these products basically improve over time based on the technology development, and then sometimes completely replace the same in the market, but the company may be the same, right? This is another type of product. The next type is repositioning. So existing products targeted to a new market or a market segment. So one very classic example is repositioning is, there is so much repurposing or redrafting of drugs, medical drugs during the COVID pandemic, right? So many a times we have heard about this term hydrochloroquine, or there are so many other medical drugs which were used and repurposed to possibly target the COVID virus and the initial variants, and many of them did fail, and many of them did show some immunity or effect on the virus, but that was one of the repurposing. So something is already being used for, let's say, malaria, and that is being used for something else. Fabiflu is another example where that was used for a different purpose, and that was partially repurposed, right? So there are many other aspects which are kind of repurposed. So there are watches which were earlier used specifically for, they had all the details of measuring the heart rate and step counts and whatnot. Earlier they were just used for athletic purpose, now they are used for medical diagnosis purpose. So that's another way of repurposing a diagnostic device, right? So here you do not change the product, but you kind of market it in a different target segment, right? So that kind of helps it repurpose. Another very classic example what we did for our own product was this OneSoles, where we basically had a insole variant for diabetic patients. So earlier we were using this insole variants for generic patients. Now we have repurposed it for the diabetic patients, right? Like with slight modifications. And later on we would like it to be going for some of the pediatric patients as well. Some they have some form of foot deformities or gait disorders in the earlier age. So the same formula, same material, same structure, but it is repurposed for different communities or target customers. So this sometimes becomes really important, how you remarket a product and where you do not want to build a new product. The last example is cost reduction. So sometimes if you are looking at markets where there is a lot of competition, you would like to have a very narrow margin or a wide margin with the other competitors in certain cases. One example not from the medical industry is the mobile phone market, right? So if you do not get a mobile phone with similar features within the same price point, then basically your phone will not sell. So typically what a customer would do is go to a shop and shop around for different features like this much megapixel cameras, or this kind of this size of screen, this amount of battery backup, and this amount of memory, right? So these are some of the key details which they would like, and they would like to see all the phones in that category. Gone are those days like when somebody is just looking at one brand, like Samsung for example. So these days people are looking at Oppo, Vivo. There are so many other different brands, like this there is a Redmi, and there are so many other brands like which are there in a mobile shop. So that is where you have a throat kind of competition. So some kind of cost reduction would be beneficial, right? Even 1-2,000 rupees of cost would probably earn you a customer. So similar with the drugs, medical drugs market. In the pharmaceutical market, typically what happens is you have the same drug composition which is offered by several different companies. So for example, Sun Pharma or Glenmark, or there are Abbott, or maybe this Zydus. There's so many other brands in the market in the pharmaceutical industry, probably branding the same drug for which is in the form of some throat pain, or paracetamol in that case, or ibuprofen. Same constituents, but the prices are different, packaging or branding is different. So the factor which really comes in handy here is sometimes cost. So if a huge government or private clinic or pharmacy is trying to source from these different brands, they would usually go for the L1. L1 is the lowest cost, right? So these are some of the different types of new products, ranging from completely new, which goes to a new market, to something which is totally repositioned, to something which is not built at all, like it is just a matter of cost reduction and rebranding, right? So typically looking at this chart here on the right, we are looking at a company which has a desired payback period for the R&D cost and investment. That basically means you have spent so much amount of time and effort and cost for your research and development purpose, and then finally you have come up with a product. So you do have a certain projection or plan that when do you want to reach break even. Break even is a common term where you have recovered all your money which you have put on your company. So typically, let's say I've spent 20 lakh rupees in my company so far, including the product development, production, manpower cost, electricity cost, paying for the website, app, everything included. So let's say 20 lakhs I've put so far, and let's say my products are selling at 20,000 rupees, right? So basically within 20,000 rupees, if I say sell 10 of those, like I'll be getting 2 lakhs. So if I get sell 100 of those, I'll be making 20 lakhs. So as soon as I'm able to sell 100 of those, I reach a break even. Break even means I'm in a no profit, no loss zone. So beyond that I can start making profit. So every company has kind of defined, and all of us entrepreneurs would also like to define that break even, whether that is in 6 months or a year or whenever we see the profit actually showing up, right? Before that we are at kind of a loss or a no profit no loss aspect. So typically there is this plan of this company which is in place. Then you have the customers which have a value perception or a value proposition in mind. So from every product, as we saw from the customer discovery phase, we are just trying to pinpoint at what is that within this product or the idea which is adding a value to the customer, right? It can be in the form of risk reduction, it can be in the form of convenience, it can be in the form of a reduction in cost, or something which is much more easy to use. There is accessibility, there are so many different value propositions we have talked about. So a customer typically looks from the value perception standpoint. Then you have the third thing, which is competition. So competition is basically looking at which all other companies are working in the similar domain or maybe with a similar product or service, right? So they have a certain market share already, we are sure. So if you're looking at some of the big fishes, they are already would have captured a good bit of the market. So how do you like come into this market? That is question number one. Second is they have certain product features which are there, and we need to at least beat that product feature, at least have those many product features with a certain amount of cost which is reasonable, and probably have some extra product features on top of it. Otherwise we cannot compete in the market. So there is this company's plan of action, then the customer and the competition. So all these things put together, we find a very sweet spot in between. That is where a product is typically aligned to the company's plan of action, which is your own company's plan of action. It is kind of aligned towards the value propositions of the customer, as well as factors in the different competition which is there in the market, and kind of performs in a better way, or offers something much more valuable than this customers. So if you are within the sweet spot, then you are in the right place to start looking for the further steps of your product and the product development per se. This is a good time where you will not be wasting a lot of money and resources starting to develop a product, right? So once you develop a product, you can guarantee yourself that you would at least have some customers who are ready to basically buy your product, as well as the company will support that, and the competition will not be able to steal your product or really give you a hard time, right? That's the idea. So one thing to understand and take a step back is, why do new products typically fail? And sometimes, as often said by very successful people, it is better to reflect on the failures than really spend a lot of time pondering around the success, because that is where you learn the most out of the failures, right? So it is good to know beforehand why do products fail, and most likely we will try to avoid those mistakes which several other very successful and unsuccessful products have seen in the market, right? So the first reason for failure in the market is overestimating the market size. This is a very common failure point. Typically we have done that as a part of my company, and I'm sure many of you would have done that and will be in the process of doing that, where you feel like your product is so generic and so good that it is going to serve a very big chunk of the market. So that's where you're overestimating the market size without doing the proper customer discovery. If you would have done a proper customer discovery, you would clearly know what your market size is, right? Second is product design problems. So there are several design flaws which can lead to an initial turn off by the customer. They may not really like to take a product which looks like that, and there are other challenges with its operation and the other aspects. So many times, if you have surgical instruments, if you're in the process of building surgical instruments, that's what your startup aims to do. So if you're supplying certain surgical instruments to the hospitals, and you see the doctors are a little reluctant in how to use the surgical instrument, and they were just fine with it with their previous instrument. So that's where you have some design flaw which you need to correct with those set of doctors only, who are your target customers, and you have to kind of speak with them as a part of the customer discovery. Because if you just do not do that and just look at the online literature and kind of try to improvise on something, file a patent and go for it, it may cause a failure, because there is some kind of a design flaw which the actual end customers, which are the doctors in this case, are not really enjoying. Another example is some kind of a diagnostic product which is not giving the right set of readings. So I always take the example of this thermometer, because this is something all of us can relate with, right? So I recently bought this nice German thermometer, and many of these features I don't know how they work. So there are just two buttons and maybe 30-50 features, right? Like, so how do I maneuver from one button to another? So there is some kind of a design flaw. And then my kid basically comes and presses the same button 5 times, and all of a sudden it sets into some Celsius mode rather than Fahrenheit, and I'm not able to change it. So I'll have to really dig through the manual and try to go back. And the manual is not very simplistic. I have to go through this 3 steps of like holding it in a certain way and then pressing something else. So that's complex. That's a complex system. Why can't a device have very simplistic system? Maybe have 1 or 2 more buttons and very simple things like you press it 1 times or 2 times, this one happens. Something very intuitive on the screen itself, or maybe some remarks under below the screen, rather than having somebody to look into the manual and really dig in. That's a lack of convenience, right? Many times you're so busy, you'll just throw this thermometer out and take something which is which you had from basic, and next time you will never recommend this thermometer to anybody. So these are product design problems, right, which sometimes we do not realize as product developers or entrepreneurs. We think this is the next big thing, but it just backfires on you, right? The third a reason of failure is the product which is incorrectly positioned, priced, or advertised, right? So sometimes you would have certain products which are not positioned very rightly or priced or advertised very rightly. So one very classic example, not from the medical arena, is probably I've given the example before of Tata Nano, which was not positioned very well. It was a great car and basically had all the features necessary for somebody with who had a bike to get a much more bigger safety for their family. If they're carrying their 3 family members on a bike, that's highly unsafe. So the vision was very clear that they wanted to have a low cost nice car which can run for a simple family of 3 or 4, right? So that was the initial idea, but it was positioned in the way that this is the cheapest car in the market. So what happened was there was this preconceived notion. Everybody thought if I buy this cheapest tag will get attached to me, and I will basically be seen down by the society that I'm so kind of poor that I could only buy this car. So that's why it kind of backfired. There were several other reasons why it backfired, but this was one of the reasons which led to the wrong positioning of the vehicle, and basically it did not gain that traction which it had to go, and basically it was a failed project, right? Very similarly done with a lot of other projects and products. For example, one is the face shields. So face shields, we have all come across one, I'm sure, during the pandemic. So if you look at the masks were positioned very well, that is the minimum thing which you need to protect yourself from the deadly virus, right? But the face shields were not positioned very well. So sometimes they were used, and majority of the times they would be kind of irritating to wear, and you would feel like you're wearing a helmet kind of thing. So it was not positioned very well in the market. So a lot of these face shield manufacturers which had produced a bulk of these face shields are just lying vacant, right? They could have either positioned it a little better, that this is the ultimate way of like basically protecting you from the virus in some sense or the form, because typically the masks which we know comes in 2 or 3 layers is not usually good enough to prevent it from the virus particles, right? The particles are much more smaller. So if this could have been positioned around that particle size or something like that, these face shields could have gotten bigger traction. The second part is repurposing of face shield. They could have been repurposed for something like so many industrial activities where you need some kind of a facial wear, like a face shield, which is a protective equipment. So they were never being repurposed. So that what that led to is a lot of face shields just dumped somewhere where they have not been finding any use. And we have similar basically seen a similar fate, where my lab had basically produced around 10-15,000 face shields basically for charity, but we distributed it to several hospitals, but later found out that we had similar other orders from other companies where we had to sell in another 5,000 or 7,500 something. But by that time the pandemic was gone. So basically these face shields then did not find any place, and they were not repurposed by the society and by us on time. So basically we could not sell them, so they are just lying in our lab, right? So that's one of the example which is of incorrectly positioned product. Sometimes they're priced or advertised wrongly. Advertised, I have taken the example of Tata Nano. Priced is typically certain products which could have been given in a much more right price were priced wrong. I'll give you an example of low price and a high price. So I had taken this example of this OneSoul's product, which my company had basically built up, and we had come through the different modes of customer discovery, and we had done all the due diligence. But what we did not do was doing the price right. So we did not think about asking too many questions about how much a particular person is willing to pay, or things like given this amount of value which this particular insole delivers, how much can you actually pay? So these kind of questions we never asked. We just assumed that let this be the lowest price possible kind of insole in the market, and maybe this would lead us to getting the maximum number of customers. So we priced it very low basically to start with, and what that did was it kind of backfired, and many of the customers thought just because the price was so low, it's not a very premium product, it's probably a very low quality product. So this is something which we learned from our own experience, that we had done the customer discovery but not asked questions about the price, and we went out and got a backfiring, right? So sometimes product when they are low priced, basically doesn't mean it is going to sell more. So we have this inhibition, we have this preconceived notion that whatever we are trying to sell through our entrepreneurial venture, even in the healthcare space, we would like the price to be as low as possible, and this would get the maximum market. Not always true. Try to match the competitors and try to get to a decent price, whatever based on the value which it is delivering. Of course, you can give a little bit of discount to the participants and the end customers, but this doesn't mean that if you could sell a product for 5,000 rupees, you just take a cut and make it to 2,000 rupees just so that you feel like this is the lowest cost product in the market. So that's not always the case, which many of us think is really the case, right? So one example of high price is typically what happens is there are a lot of very good Make in India initiatives, where we are trying to kind of rebuild and reconstruct certain products which are currently imported. There are so many medical devices and medical implants which are seeing the same thing, and basically what happens is the issue is with the last mile commercialization aspect. So typically what happens, if you are importing a product for, let's say, 20,000 rupees, a particular implant for 20,000 rupees worth from the US market, and then you have built a product in the Indian market for 2,000 rupees, okay, almost 10 times cheaper. So you would think this product is going to completely disrupt the market. It would have, if I would have sold it through my own entrepreneurial venture by having a slight margin, maybe make it to 5,000 rupees or 6 or 7,000 rupees. That's a fair amount. You're still giving quite a discount, and it maintains the same quality standards and conforms to the regulatory standards and whatnot. That is fair. But what we typically end up doing in the Indian market currently is we give this product to another marketing firm or a different company which is only interested in sale of the pharmaceutical products without even understanding the technicalities. So very often this happens with the academic industry connects. Like what we see is we have spent like this 2-3 years of time through some kind of a grant. Either it could be a private or government grant which we have used to develop a prototype of this nice implant or medical device, and then we don't know how to commercialize it, so we basically give it to one of these companies through something which is known as a tech transfer. Right, sounds very interesting, this tech transfer, but what typically happens is this company takes it and tries to match the price of the imported product. So it just completely dilutes the purpose, where the imported product was 20,000 rupees and this particular company wants to sell it for 18 or 19,000 rupees. So why would somebody buy an Indianized product in place of a imported product for the almost the same price, right? So the entire process and efforts get diluted and the product doesn't go to the market. So this is something I've seen personally, and this is something I've been seeing very often. So this is a caution that please try to price your product right, and as an entrepreneur try to sell it in the right framework, where at least if it is a make in India version of a different product which was earlier imported or is currently being imported, then what you can do is price it in the right setting, so that the price, so you're looking at a price sensitive market here, right? You cannot just match the price to 20,000 rupees and try to sell it, right? You have to your only weapon here is basically the price. So adjust the price accordingly, so that a much more low cost variant can be provided as a make in India, and this could be really valuable to the society, which cannot probably several people cannot buy this 20,000 rupees medical diagnostic devices. I'll give you a very key example. One of the devices I'd been still thinking of building, and I think this is open for grabs if any of you would be interested to build this. So this is a basically this SpO2 meters basically. So we had been using a lot of this SpO2 based devices, like which gives our oxygen levels for basically the adults. We have seen a huge insurgence of all this, like during the pandemic. So all of us have 2 or 3 lying in our house, right? But typically these measurement devices are not good for the infants. So there is a device which is good for the infant, which has some kind of a velcro type of attachment or clip kind of attachment, which they basically place on the foot of an infant, or place it around the wrist kind of. So that device is typically very expensive. It's around 20,000 rupees compared to these kind of typical SpO2 meters, which you can get for like a few hundreds of rupees, right? So if one of the companies, maybe depending on where this SpO2 meters are needed, like besides the COVID pandemic, you're looking at several asthma patients and so many other areas in which this SpO2 measurements may be important for the clinics. You can try to build one of these as an example, right, for the pediatric and the infant population, right? This could be something, a very nice make in India initiative which could add value. There are so many ideas out there in the market which can be in the similar lines, which is not being built. So please focus on make in India, and I think there is so much opportunity where I am seeing a huge inflow of imported products which are tremendously priced, like, you know, as far as the content is concerned, we have built so many devices in our lab worth really 20-25,000 rupees, and they're selling the imported products for 25-30 lakhs of rupees. So think about the amount of profit margin. I think these kind of products is another way to target the market. Look at some of the imported products. Can you make it make in India and really the right price point, right? Of course, the quality standards have to be high, right? So this is another example. So coming back to products incorrectly positioned, priced or advertised, this is where they need to be done right. You know, the costs of product development, this is another aspect. Do we add a lot of cost to the product development? So sometimes it's a tendency that we want to hire this app developer, we want to outsource this you know, money to the particular website developer. But typically, you know, how an entrepreneur thinks is, usually an entrepreneur is known to be a person who has this small garage and he is able to do 90% of the things with a very small team. Because initially, if we have raised a huge amount of fund through a VC or some kind of a setting, the bad notion is many a times we would just want to splurge that money into whatever directions we can, and we end up failing in our product. So the idea is to save every penny and try to use it in the right framework. Maybe you can save it later for your marketing. Just use it for your product development for right now, like in the right optimized version, right? The fifth point is competitive actions. So sometimes we do not take the right actions to look at the competition and acting accordingly. So sometimes we develop products which are just similar to the competitors and nothing new has really come up, and we have a slight difference in the cost. The competitors were selling it for 3,000, we sell it for 2,500 and think we can capture the market. Not a good idea, right? If you are coming as a new startup company into an established market where the competitors are already established, so many target customers have already used their product. have given reviews over like the last 5 to 10 years, why would they come to your particular product just for a 500 rupee discount, right? So something to think upon. So competition analysis is very, very important. Try to understand, if you're trying to go in a very established market, you need to know, have something little bit more than the cost, unless you're cutting the cost by, let's say, 5 times or 3 times, that's a separate scenario. But if you are just marginally cutting the cost, better look at the other features. Okay, what can you provide better? Can you provide a service along with it? Can you make it look much more nicer? Can it be much more easy to use, much more convenient? There are so many aspects to it, right? So these are the things to avoid in order to make sure your products do not fail. So as a summary, to create successful new products, the company must understand its customers. This is typically done through a customer discovery, markets as well as competitors. Most of these aspects are covered by your customer discovery. I had explained customer discovery in the previous lectures at length. Please go through this process if you have not gotten a chance, and just make sure you implement this in your entrepreneurial journey before you launch or develop a product full scale, like within your entrepreneurial system, right, or in your company. That way you are saving a lot of cost and money to go beforehand and understand the possible feedback of the customers, who can possibly buy it, who are your target customers, competitors. So these kind of things are important to understand. You are also encouraged to develop products that deliver superior value to the customers. So not look for cutting corners or just building something out of the blue, you know, like which this is just an assembly, nice looking, but it is going to fail within the next 6 months. Don't make products like that. Make products or services which are really valuable to the customers and can have a nice word of mouth and a possible branding to it. If your product is really good in the market, after a certain point the customers will start recognizing it. That's where you build a brand around it, right? So very, very important. So let's talk about the product development 7 stages here. So what are these 7 stages? The number 1 stage is the idea submission or ideation phase, which we have already completed as a part of this course, and I have given you a structure on how to generate the right idea, how to understand what is there in the healthcare space and get the right idea implemented. The second part is evaluation and screening of that particular idea, right? You want to make sure we check the feasibility of that idea to be possibly going for a product, right? So that is where we start our customer discovery and try to understand the kind of value proposition which we propose. Are these adding real value to the customers, or this is something which is very vague? Then we do something which is known as a business analysis, which is part of your business model canvas. So I had briefly introduced the business model canvas, which has this 9 different sections, and we had primarily focused on the this value proposition and the customer segment windows, right? We would slowly go from there into the revenue structure. We'll try to understand the key resources and so many other aspects, which I'll go in depth as we talk about the minimum viable products or development of an MVP in the coming lectures, right? After the business analysis, which is usually done through again the customer discovery phase, as a part of that, where you fill up the business model canvas, going from guesses to facts based on customer interviews and surveys. You finally get to the next step, which is the product development, and one of the first key steps of this is the design of a product, right? So we are kind of switching gears in this course from the ideation step to a product development stage, and getting started with the design aspect slowly. So the next phase after the development, once you have developed a design and the initial model, prototype and functional model, and you know this is a refined prototype, the next step is testing. So typically what you want to do is you need to do the product testing, you need to do a usability testing, how easy it is to use. You need to do some certain market based tests to make sure whether the customers will be actually willing to take your products, right? So these kind of testing phases, there could be regulatory tests and there could be so many other tests which are involved, and we'll be talking about those like at length. Then after the testing phase, the 6th one is validation and regulatory approval. This is where we want to make sure every part of our healthcare product is regulatory compliant, right? It is not violating any of these standards which are there in the market. This is very, very important. I'll take an example in today's lecture about how to maintain that compliance, right? And the last part is commercialization. This is where we look at fundraising, the actual sales and marketing, and how do we get this product out in the market, the final sales channels, revenue model, the entire business model we kind of revisit and start to go into the market, right? So these are the 7 different stages of your product development. So let's talk a little bit more about each of the stages with an example. So the first step, as we spoke about, is the idea generation. So typically we are looking at ideas that are unique and meet with customer needs from the spine of the new product development. So basically the ideas should be unique and should be helping the customers derive some value from it in terms of gain creators as well as pain killers. We have talked about those categories in under the value proposition segment. And the ideas should also have key features which are kind of defined or needed by the customers currently, which is either absent as a part of the system or something which can be a new addition, right? It is the most important step, typically, this idea generation in developing any new product. So if your idea is not very well defined, then usually you have a high chance of product failure. So typically one of the things which we have seen with entrepreneurs, not only with the healthcare space in general, is we spend very little time on the idea. We think like we would meet one day and just come up with this eureka moment and have this idea, and then we keep on chasing this idea for months or years, and we develop this product, and this product is ready for the market. That's typically an entrepreneurial journey, at least what I've seen personally in India, right, for very new startups. So what I would encourage you to avoid is not spending a lot of time in the idea. You need to spend a lot of time in your idea, refining the idea, doing a due diligent customer discovery before you actually develop the product. So this is very, very important. So typically this idea can arise from the market opportunities, which can be innumerable, right? So there are so many market opportunities just there. So if I, as an entrepreneur, let's say I'm just starting from scratch and I'm taking this course and I want to generate this great idea, and I'm looking here and there that where exactly can I get this idea from that which is going to give me the next entrepreneurial venture, and I'm going to make some money out of this healthcare space, right? So the places to look for ideas, like I've given you so many avenues. One is talk to the doctors, talk to the clinics, talk to the hospitals, talk to the end patients. What kind of grievances are they facing? Look at imported products. What can you develop in a much more lower cost, for example? Look at existing products in the market which are not doing very well. These are all market opportunities around you, right? And they're just innumerable. If I were you, I would start with probably, if I had all the technical know-how, I would probably take an imported product which costs 20 lakhs, I'll make it for 20, 30,000 rupees and start selling it, right? Do an initial market survey that people have, there is this existing demand for this products, there is a huge backlog because this is imported, and just because of 1 or 2 players, resellers in the market, the costs are super high. So I'm going to take this 20-30,000 rupees product for 5-6 lakh of rupees and start selling it in the market through something like IndiaMart, for example. Or it could be a better platform through some clinics and hospitals, by pitching it to them. Or there can be certain products which are sold through Amazon. So I would start that right away without wasting any further time, right? So being in the healthcare space, I think this is one of the best times in the lifetime where we can all be in this healthcare space. Just beyond the pandemic, where we all are recognizing the need for healthcare products and services, for diagnostic, for right treatment modalities. I think this is the right time to venture and look for opportunities. There are innumerable opportunities, right? So spend a lot of time into this idea generation phase. This stage also suggests that creating a large pool of ideas from both internal and external sources using numerous techniques. So you may always start with 4 or 5 ideas, and you may look at the feasibility of which one is going to get me the right revenue, or which one is feasible within a 6 months framework, or with whatever money and resources I have. So take some advice from the initial advice from the internal people of your company, or your certain people whom you interact with, or look at the external markets, what is going on, right? So to summarize, you need a lot of time to be spent on the idea generation phase, because this is the basically the foundation of your building, right? If your foundation of your building is very, very weak, then one small crack or one small earthquake, it's going to break down, right? So having your foundation strong is very, very important. Spend a lot of time. Next is sources of the new product idea. So what are the sources which are typically looked upon? The first one is customer driven, which is basically you get all your idea kind of refined or validated through your customer discovery process, where there is this idea generation, concept development and customer screening. You do the business analysis and then do the product development, consumer testing and commercialization. These are the key activities around the customer driven problems. Next is the competition driven problems. I've taken quite a few examples where you basically do a thorough market analysis and look at all the possible competitors, right? How are they doing it? How are they making it big in the market? Try to learn all that tricks of the trade, right? Then concept screening, you want to screen this concept once you have derived it from your competitor in the market to see where somebody would be willing to pay for your new startup venture, or are they more inclined towards those competitors as well? Would they be willing to change their mind if you give them a lower cost or a better quality, right? And then finally that drives the commercialization. The third type of idea is typically technology driven. So I had given you the example of this synthetic skin product which my company had developed. So this is a technology driven company or a product. So there is usually a technical need or an application idea which is necessary, which many of us entrepreneurs may not really be aware of if we are not having any experience or idea in that domain, right? So if I all of a sudden say, do you have this next great idea in the dental area? So unless you have been working in a dental clinic, or you are in touch with a dental surgeon, or you have some dentist in your friends and family, you would not really know that what is the next big idea in the dental arena. I personally don't know, so because I don't work in that area, right? So these are extremely technology driven. So this typically comes out of your daily grievances. Maybe you're working as a person who is assisting with certain clinical operations. There is a certain surgery which is done and you are assisting several other doctors and folks, and you realize this is a common practice which is of problem. So I'll give you one example. When typically a woman has delivered a baby, like, and there is this transfer from the surgical bed to another bed, what I've seen in the hospitals is they do not have a very nice practice, even in the topmost hospitals, how to shift that mother who has just delivered. She's in so much of pain and there has been just surgical operation and she's being transferred from one bed to another. If there was a seamless process of shifting that bed through some kind of electronic system or mechanical system, that could be great. So this is a technology driven. Somebody who is visiting that ward, delivery ward on a day-to-day basis can come up with this particular idea and become an entrepreneur by developing or bridging that technical gap, right? So this is how a technology driven idea usually comes into mind, right? So technology need and application idea is typically something which is part of this, and this has to be looked upon from an engineering feasibility standpoint. So let's say I've made this nice design of this movement of bed, but is it technically feasible? So there could be so many aspects that this bed is foldable and there is not so much of space available to move this bed around. The door is, let's say 3 feet, and if you make this overall bed idea, it comes to 5 feet, so it may not come out of the particular door, and there may be so many other design aspects and feasibility aspects. You need to look at that, right, while defining a technical idea. We have to do a business analysis to see who are the early adopters. Can a hospital be really interested to adopt such an idea, or this could be done in a private hospital, for example, which are much more easier to change or adapt, right? Then we have to look at the prototype development. So here a key prototype development is very important to actually test it and understand whether this idea is going to work. The product testing and commercialization, these are the other two activities. So these are the sources of the new ideas. You can basically categorize them across this customer driven, competition driven and technology driven. So typically your next idea for your product or service is going to fall within one of these segments, right? Let's go further. So let's take this old example where we were talking about this very new product idea, which is kind of competition driven. So basically this is this Halo watch, which is your healthcare tracking buddy. That's how they would like to market it. So this is a project which came out of one of our courses, and basically the students are trying to start up in this domain, and this is kind of the adaptation of that. So Halo is this particular watch which is a competition driven idea because of the sense, because there are so many smartwatches out there in the market which have this lot of medical capabilities like heart rate monitoring, they have this temperature and other vital monitoring. Halo specifically wanted to focus on the vital monitoring and the health tracking aspects. So let's take a look into how this product came through the different stages of the product development, the 7 stages of the product development, and we'll get a clear idea of what really is going to be part of your mission, right? So the mission statement for Halo was to support traditional medical treatments. So whatever traditional medical treatments and the basic doctors based consulting or diagnosis is, they wanted to just support this with their particular device. So the idea was very clear. This is not a nice and fancy watch which you would wear for 10 other different things. This is typically for supporting the medical consulting or traditional medical treatments with accurate body vital statistics. So the keyword here is the accurate, and it is wanting to focus on the vitals only. So vitals are typically like body temperature, heart rate, it could be the pulse rate and so many other details, right? To ensure healthier future and longer life, right? So it wanted to focus on the continuous monitoring, and we have talked about Halo at length. This is something which focuses on just the vital measurement on a dynamic mode and wants to give right information for a doctor's consulting or when exactly you should consult a doctor, right? So the mission statement is very clear for Halo. They have made a very nice logo. This is something which would look attractive, and kind of they have an attractive segment as well, right? So they first of all looked at the smartwatch market. So smartwatch market is growing at a compounded annual growth rate CAGR of 19.6% globally, which is fairly high at a CAGR of 23% in the APAC region. APAC is the basically the Asia Pacific region, which includes India. So smartwatch market in India grew 274% in 2021. Phenomenal growth. 274%. You are looking at 16%, 19%, 23%, and here you are looking at 274%. Massive growth. So which are some of the domestic players? They stood at taking the 75% of the market share. This is another very interesting fact. We are not using a lot of imported smartwatches, which is great to know. I'm a big support to the Make in India watches and Make in India products. If they are of high quality, I would encourage you all to make that. Like, so 75% of the market share is held by the Indian products, which is great to know. These were in the position to gain share from the Chinese players like Amazfit and Realme. There are some Chinese players out there which are almost shifting gears or switching the statement, where they are trying to get more Indianized than Chinese, because we all know that a lot of Chinese products or Chinese based equipments are very low cost. Quality wise, it's kind of something which needs to be compared, but the cost is very low. That's why earlier many of the products in the Indian market could not compare that cost, right? But right now, with the pandemic and switch with socio-economic and the demographic conditions, the shift has moved more towards Make in India, and with the support of the government, there is a huge opportunity in this watch market. So coming back to this was the smartwatch market which they looked at. Some of the top sellers were like Boat, which is a totally Indian company, and we have seen some parts of Boat and Shark Tank as well. Right, the founder of Boat was part of that group. So Boat is a very big market which is coming up with these kind of watches. Then there are several other companies like Firebolt, Realme, Amazfit. Amazfit is a Chinese company. Apple, if you would think of having a larger share, doesn't have such a big share. Specifically due to the cost, I would think, because the cost is fairly high. It's not very affordable for majority of the customer segments. If you're selling a watch for 50,000 rupees, I think even the middle class would be reluctant to buy it unless you want to really be going for the Apple brand, right? So this is the distribution of what the market looks like, and one of the key things which we look at here is the Indian brands are selling very well, right? Boat and Noise, right? So let's go further. So some of the key facts about the customer discovery and initial idea assessment was 34.6% of the elderly population exist in India, like who are above 60 years of age. They typically suffer from cardiovascular ailments. So 34.6% of the elderly population above 60 years are suffering from cardiovascular diseases. We had kind of visited this statistics as a part of the Apple Watch case study. But this is just a case study and fact which is existing right now. Again, population above the age of 60, you typically 32% of that specifically in India suffer from hypertension, right? 8.3% of elderly population above the age of 60 suffer from some form of lung disease such as oxygen level related complications. So this kind of indicates what kind of sensors or features we should have as a part of this Halo Watch project, right? So cardiovascular ailments have to be attended to, hypertension has to be attended to, and the third is oxygen levels through some kind of SpO2 readings, right? The fourth statistics is 44% with increase in age from 45 to 75. These are the folks without any comorbidities. This reduces from 67 to 44%. So basically, we are seeing at a high comorbidity typically at a higher age. So that's another aspect. 1:379 doctor to susceptible age population ratio. Difficult to get a doctor for consultation. So typically, what has been seen through statistics, there is just one doctor per 379 9 persons, right? Like, or possible patients. So you're basically fighting for one doctor in India currently for 375 patients. So with this, we are going to close this session. We will continue this topic in the next lecture. So thank you all.